I want to talk about a genius idea to end the coronavirus pandemic, okay? This is not a new idea. Donald Trump had this idea some months ago, but he's revitalizing it. Here's the idea, okay? We want to get rid of all cases. Ready for this? Stop testing. Don't do a single test. We won't find a single case. This is the idea that Donald Trump again is suggesting, proposing. He said this yesterday during one of those lame propaganda roundtable events. He was asked about the reality that the United States is still finding 20,000 or more new coronavirus cases a day. States are reopening. Some states very unsafely, Arizona, Florida, Texas, North Carolina, California. These states are having more and more and more cases almost every single day. Trump's about to hold a huge rally in Oklahoma. Well, what if we just stop testing? Take a look. You just have to see it to believe it.
As I said this morning, that's probably the downside of having good testing, is you find a lot of cases that other countries who don't even test don't have. If you don't test, you don't have any cases. If we stop testing right now, we'd have very few cases, if any. But we do. We're at a level that Mike is going to talk about that's so high, but we will show more cases when other countries have far more cases than we do. They just don't talk about it.
So there's actually so much to discuss here, and it's kind of a good opportunity to do a little bit of a reset in terms of where we are nationally with coronavirus right now. So first of all, remember, testing more will find more cases. That's true, generally speaking, but testing more over the long run reduces the spread, because as more people become aware that they have the disease, they stay home if they're normal people and they don't give it to other people. So yeah, in a sense, if you don't do any tests, you don't find any cases. But in terms of the real spread, the more testing you do, the better you mitigate the spread of coronavirus. By the way, we're still not testing 500,000 people a day on average. A couple times in the last 10 days, we hit this number, 500,000 tests a day. We've been talking about needing to be at a minimum of 500,000 a day for 3 months at this point. We're still not there. Okay, so reminder, we still are not testing enough. Then Trump continues to insist that we test so much. We test more than anybody. The U.S. is currently 28th in testing globally. This is per capita testing. This is a really important detail about testing, because one of the reasons a couple months ago, we were like 45th in testing. Now we're 28th. One of the reasons that we've inched up to 28th in testing is that there are countries that no longer need to test because they've eradicated the virus. Imagine that. Like, for example, South Korea. We talked about South Korea's early testing program. Now the United States is testing more than South Korea. Why? Because South Korea only ever got to 12,000 total cases. South Korea only ever had 278 deaths total. The entire pandemic in South Korea was 278 deaths. So, of course, we're now testing more than South Korea. They don't really have a coronavirus pandemic. Secondly, there are other indicators about how the virus is going, even if you don't test. So you could suppress testing numbers like Trump is talking about for some period of time, but you have hospitalizations, you have ICU usage, and eventually cases turn to death. So even if you don't test, eventually the truth get out. It's like saying if Trump doesn't get himself tested for an STD, he won't test positive for an STD. Well, that's true, but eventually things are going to start looking a little bit wrong, if you understand what I'm saying. Now, it's true that it's harder to find the hospitalization numbers. Most national dashboards include cases and deaths, not hospitalization. So you've got to dig a little bit more, but the data is there. One other really bizarre moment from this roundtable, Trump was asked about hydroxychloroquine being taken off of the FDA's emergency use list. It was taken off because it's not working, and Donald Trump very irresponsibly promoted it for a long time. Trump said when he was asked about this, well, there were good reports about Hydroxy from other countries, but then he sort of got irritated with his own Secretary of Health and Human Services, Alex Azar, and turned to Alex Azar and said, why don't we have some of these good reports, Alex? Take a look.
Great reports coming out of France, coming out of Spain, coming out of other places. The only place we don't get necessarily reports are coming out of Alex's agency or wherever they come from. I don't understand that, Alex. What is it exactly? Because I have had so many people that were so thrilled with the results from Hydroxy. So what is that exactly?
Well, at your direction, we continue to study, especially in earlier phase. So a lot of the data that has come out that was more negative was people who were quite ill in the hospital.
People that were like seriously ill, like they weren't going to make it. Let's give them a little Hydroxy, and then they don't make it, and they say, oh, wow, maybe the president was wrong. All I know is that we've had some tremendous reports. I've had a lot of people tell me that they think it saved their lives. You know, the one woman who's a fan.
So this is just great insight into Donald Trump's lack of understanding of how medical research works, what randomized controlled trials are, what it means to have a placebo group, and so on and so forth, double blind, how you actually test something empirically. And arguably even worse is that people around Trump, like Alex Azar, continue to placate Trump and pretend like, well, you know, yeah, some of those tests were on very sick people, but we should really be looking into hydroxychloroquine on people who aren't so sick yet, prophylactic use. They just keep placating Trump endlessly. Now, one more thing to prepare you for the coming wave of propaganda. The Trump administration is already floating blame Mexico in terms of, you know, some of these states now having spikes are southern states that share a border with Mexico, Arizona, Texas, for example. So they're floating blame Mexico for the spikes. No evidence of that, by the way, that Mexico is responsible, combined with blame protesters, even though a lot of the states that had the bigger protests are places that are not seeing a spike, the protesters mostly wearing masks, whereas in places like Arizona and Texas, things are open, almost nobody's wearing masks, and that's really what we should be looking at. So just to prepare you for the coming propaganda wave, make sure you're following the David Pakman Show on Instagram at David Pakman Show for more on testing and cases and Trumpisms that continue to plague the country.